China's COVID approach highlights unity and community with a shared future. The last Chinese New Year holidays were always destined to be extra special, not only because millions of Chinese families finally gathered together but also because China's homemade sci-fi blockbuster The Wandering Earth 2 hit record-high box office receipts and touched the hearts of many moviegoers, resonating with ordinary people who looked back to an unforgettable 3-year battle against the novel coronavirus. United States. Love, family, unity, hope and coexistence are elements highlighted in the highest-grossing sci-fi epic, which could also vividly explain why China can steadily walk out of the shadow of the epidemic and embrace a new beginning, striking a sharp contrast with the path taken by the United States-led West in confronting the unprecedented public health crisis. When China entered a new stage in COVID prevention and control, some Western media outlets describe the COVID policy optimization as a U-turn and an abrupt policy change, hyping China's failure to put the United States under control and wondering whether the failure would further prove that the so-called democracy in the West had won. Some Western politicians and observers slandered China's epidemic policy by saying that the Chinese public only apparently accepted it in the context of an authoritarian political system. However, over the past 3 years, some memorable moments illustrating different COVID approaches, a miniature of social governance, showed why China's anti-virus United States battle is fundamentally different from that of the United States, according to Chinese doctors, public health experts and ordinary people. Differences in the COVID response between China and the United States are underscored by unity versus divergences, top-down resolution with effective measures versus chaotic policymaking, science-driven and fact-seeking attitude versus politicization of the epidemic for political battles. When China imposed the initial 76-day lockdown in Wuhan, the city that first reported the COVID infections about 3 years ago, the whole country fully mobilized and made all-out efforts to provide as much help as possible to the city capital of central China's Hubei province, at the beginning of the outbreak. But in the United States, more people died, and more Americans lost the trust of their institutions as a result of the United States federal government's decisions in the early days of the COVID-19 pandemic, according to an investigative report from the Democratic staff of the Senate Committee on Homeland Security and Governmental Affairs unveiled in December 2022. When Chinese officials, frontline medics and social workers run around the clock to save as many lives as possible from the epidemic in the past 3 years, COVID has become a political issue in the United States, with political polarization becoming more evident and intensifying. Democrats and Republicans have been at odds over mask mandates, vaccines and epidemic restrictions, and it was widely reported by United States media that unvaccinated Americans are more likely to be Republicans, who led the movement against vaccination, or a science-led approach. 3 years of anti-epidemic experience tells us that we should adopt anti-epidemic measures in a scientific way, including increasing vaccination, enhancing research and development into vaccines such as nasal spray vaccines and antiviral drug research and development, Liu Hongzhou, head of the Third People's Hospital of Shenzhen, told the Global Times on Sunday. However, in the United States, the available vaccines and medications remain out of reach for a vast majority of Americans, which is also a result of poor communication by federal officials and other bureaucratic barriers, the New York Times said in an article in August 2022. Director of the United States Centers for Disease Control and Prevention, CDC, Rochelle Walensky also wrote in the Washington Post on Sunday that political pressure and manipulation by the former Trump administration early in the pandemic played a role that fostered more significant skepticism about science and debate over whether public health interventions infringe on personal freedom. The United States CDC, the nation's premier public health agency, saw its demoralized workforce exhausted, its authoritative voice diminished, and its data-gathering processes needing to be more manageable. The United States marked 1 million deaths of Americans from COVID-19 in May 2022, and Omicron set records for COVID infections in the United States, heavily weighing on United States medical systems and driving burnout among medics. After 3 years of arduous battle, many Chinese medical workers like Zhou, a frontline doctor who witnessed the lockdown in Wuhan and the country's top-down support for the city, said they accumulated abundant experience in treating patients infected with the coronavirus, especially those with severe symptoms. But in the United States, life expectancy dropped for the second consecutive year in 2021, falling to the lowest it has been since 1996, CNN reported in December 2022, citing final mortality data published Thursday by the United States CDC's National Center for Health Statistics. More than 3.48 billion doses of COVID-19 vaccines have been administered, and the total number of people vaccinated is 1.31 billion, according to a report released by China's CDC on Saturday. Of those, 1.27 billion have been fully vaccinated. In addition, the number of people who have completed at least one booster immunization is 827 million. After China optimized its COVID response, the country's new phase of epidemic fighting focused on protecting people's health and preventing severe cases. The spirit of working together to safeguard a community with a shared future was also underscored in the movie and the daily life of Chinese people. A female Taiwan resident currently living in Shanghai told the Global Times on Sunday, on condition of anonymity, that was generally speaking, she feels safe living on the mainland, and she could get together with friends, eat at restaurants and have entertainment during the 3 years. China is poised to withstand the hard COVID test for the Chinese New Year holidays as most cities and regions have already passed their infection peaks, and adequate preparations and contingency plans were put in place by authorities at all levels. The hard work of medical workers and enhanced vaccinations have allowed residents to enjoy a safe and warm spring festival without triggering a large-scale resurgence of infections so far. Some public health experts believe that the country will confront the virus and its variants more calmly and confidently after going through the latest waves of infections.